Lucia Jig, and this is what I used to do all the time. Lucia Jig, it just gives you really good seating point for patient and hard point, and patient can really bite it. The only thing is it takes a little bit longer to make and it's time consuming, but otherwise it's a really good option. And number 4 is wooden spatula. So many dentists would use wooden spatula on both sides of the jaw and bite, really ask patient to bite hard and assess. I don't tend to use that very often. For me, leaf gauge is really the way I do the load testing. So make sure you do load testing for your patient before you do full mouth reconstruction. Now, one time you can get false positive, which means you get pain, but it's not from intracapsular area, is when you ask patient to do load test and you do load test, patient's lateral pterygoid muscle is in spasm. When that is happening, patient can get pain around the TMJ, but it's not coming from the TMJ area. To break that spasm, what you could do is ask patient to bite on a cotton wool rolls, put cotton wool rolls on both sides, ask patient to bite really hard, release, bite again really hard, release, maybe do it 3 times, and then do the test again. If it's a spasm, that sort of a procedure which breaks the spasm most of the time, and then patient gets better. Now, if patient gets pain in load test, do we know 100% that patient is in CR and that's the reason they're getting load test pain? We don't know. So I then give patient Michigan splint for all the patient who gets pain, so that I can reassess after 3-4 months down the line, making sure all the muscles are relaxed. And if patient's still in pain, that means it's more likely that it's intracapsular rather than muscular pain. So I hope you enjoyed this video on how to do load testing and why we are doing load testing.